Well, welcome. Thank you so much for joining us. We will be recording our workshop today for anyone who is unable to join us. My name is Jen, and we're very, very happy that you all have come to join us in our Raise Your Voice for Healthcare Justice. This workshop about sharing the Minnesota Health Plan came out of a summer of advocacy work. Finally getting to be in person once again. And we realized that some of us are a little rusty and could really use a little bit more practice to become comfortable either for the first time or once again, speaking about single payer healthcare reform. So welcome. So today this presentation is being put on by Physicians for a National Health Program of Minnesota and Healthcare for All Minnesota. We have an educational workshop or webinar every month on the second Tuesday of the month, second Thursday in the evening. Sorry. Our agenda for tonight, we're going to start with our purpose statement, why we're here. We're going to do a quick overview of the Minnesota Health Plan. We are going to talk through conversation mapping and how to get started just talking with people. Using your own story to make an impact, making it personal, best practices, and using frequently asked questions. We're going to give everybody the opportunity to practice just having easy breezy conversations about healthcare reform, which, I mean, that seems like a complicated thing right there. But it's a nice friendly atmosphere. Everybody can just relax and be comfortable. There's no pressures. So a good way to practice, and then we'll wrap up with next steps and let you know what's coming up in the future. So my name is Jen Crawford. I'm the Executive Director of PNHP Minnesota. I'll be presenting a bit tonight along with Judy Barton, Administrative Coordinator of Healthcare for All Minnesota, and Ann Jones, retired registered nurse and Vice Chair of Healthcare for All Minnesota. Our breakout room will be moderated and led by a number of HCAM board members. We have Dr. Mark Brecky, David Garibaldi, Dr. Jim Hart, and Don Pilkinen. So we thank them so much for joining with us tonight and helping us out. So we'll jump right into the content here. Why are we here? Well, with all grassroots movements, it takes people power. We're not going to be able to do it without people. So Anne, if you want to give her a click. There we go. All right, so to win, we need to add supporters. That is not a pyramid scheme. That is grassroots organizing. We cannot grow our base without individual voices sharing the truth about reform. But each of those voices, you and me and the people that we bring into the movement, we all need to be able to put into words why the fight matters. And we need to be able to make it personal and talk about what it means to me, what it means to you, what it means to our society, and why we're fighting to make this happen, to make it, mean something. We're going to be working on different skills tonight. We're going to talk about how to start a conversation in different situations. If you're door knocking, if you're volunteering and tabling, if you're just chatting with somebody at work, every situation is a little different. Some of them are high stress, some of them are low stakes, and we're going to talk about those different opportunities tonight. We're going to talk about how to manage questions with optimism and tact, and also give you an example of not being tactful. Just so you can avoid that. Stay tuned. We're going to talk about how to activate your supporter, because bringing someone to the movement, it doesn't do us a lot of good if it stops right there. We would need them to build along with us. And finally, we're going to talk about when you need to shift the focus and how to walk away from conversations that aren't getting to where you need them to be. So that's our overview of the evening. And now I'm going to hand it off to Ms. Ann Jones, and she's going to talk to us. She's going to do a brief overview of the Minnesota Health Plan.
Thanks, Jen. Thanks so much. I'm going to talk just really quickly about what we're fighting for. And just to emphasize something that Senator Marty often says, this is not a wish list. These are requirements for the Minnesota Health Plan that would be required in law. and the Minnesota Health Plan Board would be responsible for meeting these requirements. So the Minnesota Health Plan is a single unified system that would cover all residents of Minnesota for all medically necessary care, including dental care, mental health, and long-term care. And the Minnesota Health Plan changes how we pay for health care primarily. The healthcare delivery system remains pretty much as you experience it right now, which is actually a mix of public and private providers and facilities. But since government is the payer, not the provider, in most cases, you, the patient and beneficiary, would have the freedom to choose your doctors, your hospitals, clinics, drugstores, any healthcare delivery system and provider you need, and assigned networks are eliminated. Premiums would be based on ability to pay, and you would experience no surprise bills from out-of-network providers, which has become a really expensive and unwelcome part of our current system. Costs would be reduced by cutting administrative waste, not by denying care. And the MHP board will be able to negotiate prices, will address shortages in providers and essential services such as dental care, mental health, obstetrical care, and would work to ensure that they are properly distributed around the state, would provide stable funding for hospitals, clinics, and other facilities in rural Minnesota and underserved urban areas. The Minnesota Health Plan includes funding for a just transition for any workers displaced by moving to a single payer financing system for healthcare in Minnesota. And this is really quick. So for more information on the Minnesota Health Plan, please go to www.mnhealthplan.org, and also commit to reading Senator Marty's book called Healing Healthcare, the Case for a Unified Healthcare System, Payment System in Minnesota, which is available on the MHP website or the MN Health Plan website, and also on our website, hca-mn.org, under the Resources tab. So thanks. Judy, go ahead. Next.
Need to unmute myself. Thanks, Anne. So now I'm going to go over just a general conversation map. So this is kind of like an outline of how conversation should kind of follow and go. So the first thing you want to do is introduce yourself, why you're there in that moment, whether it be at a tabling event or if you're talking with a friend or a coworker, and why it's important to you in that moment. Go ahead and hit enter, Anne. Then you want to ask a question to get the person involved in the conversation. So if you're tabling at an event, you may introduce yourself, but you may also just start with a question as somebody's passing by in the case of tabling an event. Next, if you feel comfortable and it makes sense in that moment, you can share your personal story. So this matters to me because then the person will probably ask questions or have a comment. And so you want to respond to those questions and comments in order to deepen the conversation. And then finally, at the end of the conversation, you want to give them at least one direct action to try and get them involved in the movement. So first, we're going to talk about conversation starters. So these are questions to kind of get the person engaged and get them thinking. It's a great way to start a conversation about Minnesota Health Plan or anything actually, but Anna, if you want to hit enter, we can. So these can be things like, how do you feel about the cost of healthcare? Have you heard about the Minnesota Health Plan? Are you happy with how much you pay for healthcare? Do you know how much you pay for your family's healthcare each year? And do you want to help us fix how we pay for healthcare? One more time, and one more enter. So what I'm going to ask everyone to do right now is put your favorite conversation starters that you've used in the past, maybe in the chat, or any that you think of right now. And I'll give you guys a few minutes to do that, and then we can share some. So what do you know about single payer healthcare? That's a great one. How is our healthcare system working for you? That's another good one.
Mhm.
And there's so many of these that you could choose. How many vacations could you take if you didn't have to pay for healthcare each year? I really like that one. And vacation is always nice. Something, you can insert something that people care about, How many more cups of coffee could you afford at Starbucks or, whatever it may be? Great. Those are some great questions. So I'm going to move on now. And you can keep looking and reading those in the chat. Okay, and now we're going to get to the why I care, your personal story. This is something that you may or may not use. It depends upon the situation and if you feel so inclined to share it. So this should not be, you should care because. That's not what you want to say to people, but it should be something along the lines of, I care about healthcare reform because. I'm gonna keep talking for a moment, but if you have an I care statement that you would like to choose, please put it in the chat. But I'm gonna talk a little bit more about this while we do that. Again, if you don't have an I care statement right now, that's okay. You can take your time and figure it out. Again, it can be very personal sometimes, so it's okay if you don't want to share it. But sharing why you feel something is important is really good because it can help a person become introspective. We all have different experiences and values, and their why may be different than yours, and that's okay. So let's see. So Dr. Crossan says, I have been involved with many patients who have avoided healthcare because they could not afford to go to the doctor. So that could be a personal statement as to why this is important to me. I had to pay $7,000 for replacing one tooth. Now I understand why people walk around with teeth missing. Another important one. I care because it's hard enough to be sick and care for sick people without all the barriers in our way. I care about healthcare reform because I'm tired of feeling guilty for being sick. My family deserves to have more fun instead of paying bills. Great ones. I love it. So for me, one of my reasons that I care is I have two kids. They've both been very sick, and I think about, what would have happened if we didn't have a good health plan when they were in the pediatric intensive care unit. And I don't want any parent to ever have to worry about their children being sick and having to worry about how they pay for it. Okay, moving on. So next is responding to those questions to deepen the conversation. The first thing is really try and keep it positive. We're all surrounded by so much negativity that when we can keep something positive, it's always a good thing. Next, resist any attempt to make it political. It seems that everything these days has become political, and we all need healthcare no matter what side of the aisle we're on. So it's also kind of a matter of respect for people. You might not know that person and what their political beliefs are. So trying to keep it more neutral is always a good thing. Next, reframe any negative questions and comments or any preconceived ideas. We'll get back to this in a little bit when we do some examples. Best practices. Give yourself some time to think before you answer and avoid sounding defensive. So something could be like, wow, that's a really good question. Give me a moment to think about it. It is totally okay to say that. Or you could say something along the lines of, if you don't know the answer to the question, say, I'll find out and get back to you, or refer them on to either HCAM or PNHP. Next, clarify the question if you don't understand it. Back when I worked with kids in mental health, my supervisor, my boss, who was a psychologist, gave me great advice. She says, no matter what somebody says, even if it sounds totally crazy, Always just repeat it back to them in different words. And 99% of the time, if it's something crazy, they will then be like, well, that's crazy, because they're hearing it in a different word and in a different way. But also, if you're misunderstanding them, it's a great way for them to clarify what they're saying to you so that you're on the same page. And then finally, be confident by being well informed. Do the research, ask questions yourself. If you have a question about it, always feel free to email us to ask us those questions. Finally, as Anne pointed out, read Senator Marty's book. That's a great way to become well informed. So, words and phrases to use. So, 1, freedom. This gives you more freedom. It gives you more ability to make personal decisions for yourself. Freedom is a great word here in the US. We love our freedom. Number 2, choice. It allows for more choices. You choose your doctor. Again, another good word that's very close to freedom. It's cost effective. We also love to save money here in the US. And I think everybody is always concerned about our economy and how much things have cost in the current state of inflation. So anytime we can say something is cost effective, that is great. Fair and just. Everyone has needs, and we want everyone to get the care they need when they need it and not have to worry about paying for it. And then finally, healthcare decisions. You have the power because it involves your health. You and your doctor make the decisions, not insurance company. Next, word to avoid. So again, going back to it, avoid those you statements. And this is really key for those personal statements that you have. So avoid those you statements saying you should feel, you that, but instead go to those I feel, or I found that, or in my experience. Avoid you're wrong and other negative commentary about their thoughts and opinions. You can say I disagree, but, or I hear that a lot. If you know it, if they're saying something that is a common misconception, to say I hear that a lot. Are you aware actually, or have you thought of it from this perspective? Avoid, again, political rhetoric. Healthcare is a universal issue, and it is supported by people who identify with both parties. And then last, this is kind of a little controversial, but the term Medicare for all can be problematic for various reasons as well. Some people associate Bernie Sanders, so if you're talking with somebody who may be a little bit more right of center, they may tune out as soon as they hear it. Some people have had negative experiences with Medicare coverage if they need services, or something's not covered and they get frustrated. So something you could say is the Minnesota Health Plan is a single payer solution to our healthcare mess. My general rule regarding this is I don't completely avoid it, but I let the other person bring it up first. So if they say it, then I'll use it because I need to know that they're okay with that phrase, Medicare for all. And another thing that a lot of people use is instead of saying Medicare for all, they'll say improved Medicare for all, because the system we're talking about would cover more than what our current Medicare system actually does cover. Next, when to pivot or walk away. This is complex, but sometimes you will need to walk away from a conversation. So when the conversation stalls, but you see the person could become a supporter, change how you're talking to them, enlist resources or refer them to an organization such as HCAM or PNHP. So you could say something along the lines of, I feel like I might not be explaining this well enough. Can I give you the contact information? Or you could say there's an excellent book. Can I recommend Senator Marty's book? Those kind of things. So when the conversation stalls and you do not see the person becoming a supporter, it is okay to walk away. You can say, I don't think we're going to agree on this issue. Thank you so much for your time and speaking with me today. And then just walk away. Also, if somebody's being disrespectful, this doesn't happen very often, but if it does, it is okay for you to say, I am feeling disrespected, and I think we need to end this conversation. Don't feel bad if you have to do that. Again, that happens very, very rarely, but if it happens, say what you need to say and walk away. Finally, if someone requires too much of your time, suggest a follow-up at a future time. So use your judgment here. Some people want to tell you every personal health care experience that they've had that's negative. So you could say something along the lines of, it sounds like you have a lot of reasons why you think we need something better here in the US. So sign up and join this fight with us. Okay, now we're going to get to responding to frequently asked questions, how to positively reframe them. So I'm going to ask the first one to Jen. Jen, do you really mean cover everyone? That seems way too expensive.
Oh, that is something I hear all the time, Judy. Go ahead and click it again, Ms. Ann.
Click it one more time, Ann.
Oh, sorry. Jen, is your microphone up all the way?
There we go. Good news, Judy. We already spend more than enough on health care in America to cover everyone, plus improve benefits, all by getting rid of the insurance company middleman, removing excessive profits, and reducing administrative waste.
That sounds amazing.
All right, Anne, what about the long wait times? You want us to wait months and months to see a doctor like in Canada?
Well, this insurance industry talking point has certainly taken hold, hasn't it? The truth is we wait to see healthcare providers here in the US. You may even have had that experience yourself, but especially certain specialists. The big difference with the system that includes everybody is that people can actually be seen. Unlike our situation where people do wait in line sometimes forever if they have no coverage at all, or those whose out-of-pocket costs are so high that they can't afford to use the health care that they pay for. So Judy, won't lots of people lose their jobs if we get rid of private health insurance companies?
Well, Anne, that's a great question, and I understand your concern. This bill actually has some provisions in it and built-in incentives to retrain current insurance workers. The opportunity for small businesses to actually expand because they won't have to worry about paying for health insurance for their employees, plus the need for additional healthcare providers. The Minnesota Health Plan works out to be a job creator. Okay, Jen, but will this ever actually happen? How long will this take?
Well, these days it feels like it's taking forever, Judy. Just kidding. The Minnesota Health Plan has already been proposed in the Minnesota Senate and House, has dozens of champions. There's more than 60 co-authors right now, and it can pass within the next few years if we all work together to demand change and make it happen. So will you help us? Will you help us to demand this change and get this party started?
You convinced me.
Yay! And I don't believe in socialism, and I don't want government-run healthcare. Everyone should work for what they get.
Well, first, let me say that social programs are for the people. But in fact, the proposals in the US are all around the concept that the government is the payer and that healthcare delivery stays mostly the same. Government acts like your current insurer. So really it's a big public health insurance program, but without all the hassle of trying to get cared for and without the profiteering that goes on in our current system. So um, you would be paying into a big pool of money that covers everybody, because we really heavily subsidize the current system. It's just that a lot of the money is not going into health care. It's going into all the layers that are skimming profits from our system. Why not save money and cover everyone? But Judy, what about death panels?
Well, I've done a lot of research on this, you smelly moron.
Wow.
That is not how you want to reply. Just wanted to wake everyone up a little bit. Definitely. And go ahead and hit the next slide.
Okay, Judy, now let's be serious.
Let's rewind.
Those?
Let's rewind. One more click, Anne. So again, don't refer to people by calling them names, obviously. So right now, my doctor can't make decisions about my care without our insurance company's approval for anything. Our current system gives insurance companies the power over life and death. These are people who actually often have no medical training and background themselves. Having protocols for unique or rare situations or healthcare directives for your care are not the same thing as death panels. Okay, so before we go to our breakout rooms to practice, just a quick review. First thing you want to do is introduce yourself and why you are there in that moment. One more. So again, hi, my name is Judy and I'm with Healthcare for Minnesota, and I'm here to talk to you about the Minnesota Health Plan. And I'm not going to read the whole thing, but to give you the idea, this is kind of my elevator speech that I had used at the state fair. Next, ask a question to get the person more involved. Have you heard about the Minnesota Health Plan? How do you feel about the cost of healthcare here in the United States? You know, and whatever your question that you like to use to start, pick a question that will allow you to kind of direct the conversation with what you feel most important about the Minnesota Health Plan. Next, share your personal story and your personal statement. This matters to me because, and again, it may not be appropriate to do this in all situations, but when you feel so inclined, we strongly suggest you do it because making something personal really does help engage other people. So it could be something I care about this because the total for my son's birth is over $100,000 without insurance. How could anyone afford that? Next, respond to questions to deepen the conversation. So why wouldn't we all support a more affordable system that covers everyone? And finally, activate them. Give them at least one direct action to get them involved. So this could be, will you help us fix the mess? Scan this QR code to sign the petition for the Minnesota Health Plan and join our mailing list. Okay. Now we're going to go to those breakout rooms to do some practice. So feel free to turn on your video if you want to and turn on your mics. And I believe, Jen, do you have any instructions for them? Jen was assigning people to the room, so maybe, are you done with that, Jen?
So when you get into your breakout rooms, you can take this time. You can introduce yourself, get to know your fellow workshop attendees. And this is a good time to work on your introduction statements, your I care because statements. You can go through those frequently asked questions and practice those tougher conversations. And if you have any questions, any situations that you found yourself in, perhaps this past summer, volunteering at the state fair. It's a good place to ask others how they might have handled the situation to learn from it. We will come back in about 20 minutes. And when we come back, we're going to have one person from each room share something that they learned, a comment that they had, something that they thought would help the whole group. And yes, so please feel free to share your questions and work from the worksheets and the frequently asked questions that were emailed to everybody earlier today. So everybody's gonna be pushed out into a breakout room. It'll be 4 or 5 people, and we will be able to just pull you back into this main group in about 20 minutes. So we'll see you soon.
And Jen, may I say a word about the FAQs?
Yeah.
Just so people know, this is a handout that a couple of us worked on maybe 3 or 4 years ago, and then a committee just of people who've worked on this subject for quite a while, including Jim Hart, Kip Sullivan, me, and Cheryl Quick, have updated it and refined it. We sent it off to Senator Marty for his blessing, but the purpose of this is to give standardized answers. You don't have to make this stuff up. You're not expected to come up with this stuff on the fly. We wanted to have some good information for people to use, and the point of this is to practice delivering the information that you can feel confident is good information. So,
all right, we'll see you all back here shortly. So you should have a button that popped up that said join breakout room. You can go ahead and click on those.
thank you.
Okay. So Jim, did you get a prompt to join a room?
Is he frozen?
I think he's frozen.
Oh.
There he goes. All right.
Did Amelia get assigned?
Let me make sure we have Amelia in a room here.
Okay.
Yeah, she looks like she's in room 1.
Okay. Wonderful. And Amelia, you should have a button that popped up that said join breakout room. Maybe she stepped away from her computer.
That could be.
Well, welcome back, everyone. We hope that you all had the opportunity to have some great conversations and to give each other a helping hand with working through some of those more difficult conversations. So room 1 was Dr. Brocky's room. Would anybody like to share anything that they thought was interesting, any comments they had, any inspirational breakthroughs that they had?
Or even questions.
Or questions, yes. Fist fights? Did anybody get any fist fights?
One thing I liked was, I'll turn my video on too. We had
Hi, Allison.
hi, good to see you. We had the question of, the classic, like, oh, I don't like government takeover of healthcare, like, as a pushback. And one answer was like, well, if you don't trust the government to like take over healthcare or to manage healthcare, like, why, like, do you trust an insurance company like blindly that who's profiting off of it? And I love that. Like, my go-to answer is always like, oh, well, the government wouldn't be managing healthcare, like that's the the UK system, all of that, and getting into the weeds. But I love that just simple, like, well, do you trust an insurance company because they're profiting? I think that's brilliant.
Absolutely. And that really opens the door to have a conversation about for-profit healthcare and the privatization of care. So yes, that is a great opportunity to really deepen the conversation like we talked about and hear about the things that people are going through. Everybody has a story about when they received a hospital bill or a clinic bill or a doctor bill. It was way bigger than they expected it to be. So wonderful. Well, thank you, Allison, for sharing. That's wonderful. How about room number 2? I believe that was, let me look at my cheat sheet here. That was Dave Garibaldi, and Elise and Judy, Kenneth, and Linda. Did anybody have anything they wanted to share from their time in their breakout room?
Well, I'll chip in. We had some great conversations about some ideas of what isn't being talked enough about, and I think Ken had a couple of great things to say. That tying health insurance to employment, he had lost jobs, said like 3 times, he said, and in between you're trying to pay for premiums, which are sky high because you're paying the employer's portion that you didn't have to foot the bill for before. And tying it to employment is just crazy. And we got into quite a discussion that about the old choosing a plan that's right for you, having choice. And we had a little back and forth about our congresspersons. My congressman, Dean Phillips, likes to tout that Americans want choice. They want to have the freedom to pick a plan that's right for them. And Ken and I agreed vehemently that, and he's got, Angie Craig says the same thing. And he agrees totally that how do you know what you're going to need tomorrow?
Mm-hmm.
So those were some good things. And Judy mentioned down at Gustavus talking to kids about healthcare, and a lot of people, a lot of the kids, you always think, well, college kids all are on their parents' plans, but those that are not as affluent may not be. They might be there for have some assistance going to college, and they might not, their parents may not, very well not be insured, so they're winging it. So and Linda mentioned the complexity that and the complex wording that's going on, especially in the Medicare field all the time, about different plans and again the choice that's right for you, and it's almost meant to confuse you.
Mm-hmm.
And Elise was mentioning that I thought this was really brilliant, that yes, we should have financial instruction to kids in high school, and insurance should be talked about so that they know what they're heading toward. If they, so many times, like at State Fair, I'd run into kids that just, they just didn't know. They didn't know what it costs because they were covered under their insurance plan, parents' insurance and stuff. So that's kind of the highlights.
Yeah,
Sure, and a
definitely.
great thing when people bring up like Dean Phillips and Angie Craig would say things about choice. Well, you know, this would give you choice to choose your provider. It would give you choice in
Mhm.
determining what treatments you have without the healthcare insurance company saying, no, you can't have that treatment, or you know, all that pre-authorization stuff and whatnot. So it would be real choice.
We have to flip the narrative on that word.
Yes.
We desperately have to flip the narrative on that word. That has become so ingrained. We don't care about a choice of insurance plan. People
And you
care
cut out.
People care about seeing the doctor of choice, going to the hospital in their town.
Yes. Great. So what about room number 3? That was Don Pilkinen's room. So it was Cheryl, Don, Gary, Mary. Does anybody have anything they'd like to share?
Well, I can start off and then others can add to the conversation that we had. John and Mary and Cheryl and Gary and I were in the group, and they've been on the front line with people in their walk of life. And so they right away have empathy with folks struggling in the current system. And they all have a pretty clear and people-orientated explanation of the Minnesota Health Plan without getting too much into the weeds, as it should be. And I'd like to have John or Gary or Mary or Cheryl just pitch in on how they felt the conversation went.
Oh, Gary, you need to unmute yourself. There
How's
you
that?
go.
Better?
Yep.
Okay, thank you. Yeah, we talked about the affordability of single payer health insurance and how the cost ranges from a little bit to a lot, depending upon where you are on the income level. And that's what makes it nice about the single payer health insurance, is everybody doesn't pay the same. You pay according to what your salary happens to be.
Yeah, and John said that it's he used the word progressive in partly defining the Minnesota Health Plan, and of course that defines the fair, affordable way that it's paid for, based on a progressive method of payment.
Absolutely. Yes, progressive, not regressive. Wonderful. Does anyone else have any any inspirational thing that they'd like to share with the group? We can take another 2 minutes or so to keep, talking. Or if anybody had a question that they didn't have answered, now's a good time to use our hive mind.
Is that all of our breakout rooms, Jen?
Jen, can I comment? I think it was the first group. This is Linda Hartman. And I just wanted to add, Ann Jones has always been really good at answering that question about, well, I don't like government health care and stuff. So I think I've got her routine down now when I hear that. And it's not socialized medicine. I mean, they have to think about so many other things out there. For one, the VA system is a government-run program, and it's one of the best healthcare programs out there. And then our roads, I mean, our schools, can you imagine if you had our schools run like our healthcare system? So there's a whole list of things when people complain about, oh, I don't want the government to run our healthcare. Anyway, maybe Ann could.
Thanks, Linda. I like to say there are a lot of things we do together, and I have a whole big long list of things we do together, and it's a lot more efficient to fund public services together, like schools and police and fire and military and emergency disaster preparedness. And none of us could afford these things on our own. It is far more efficient and effective to fund important public services and human needs together. And there's no reason healthcare couldn't be one of those.
Ann, this is Jim Hart. I'm going to test you a little.
Yeah.
So I was at a door knock up north of Duluth on Sunday
Oh, okay.
with us, and there was a group of folks from the Carpenters Union,
Uh-huh.
and they're the leader of the group. We got chatting a little bit about healthcare, and she says there's no way that the union carpenters would ever be interested in single payer because they have such wonderful benefits, and there's just no way that they'd be as good. What do you say to that?
Well, according to the Labor Campaign for Single Payer, Ann Rose has done a lot of work interacting with labor unions, including the building trades. They're working pretty hard on the building trades. Labor unions are spending almost all of their negotiating power on preserving this ever more expensive health insurance benefit. They cannot work on pensions, on terms and conditions of employment, on wages, because almost all of their bargaining capital is expended on just trying to preserve what is it's a more expensive and less useful. And I've talked to lots of people in labor unions who've said over the years their out-of-pocket costs have exploded. So there's two things: it's not working, and their out-of-pocket costs are going up, and it's at the expense of every other benefit they might like to try to negotiate in their contract.
Yeah, I suppose it varies from one union to the next. I did encourage her to go back and take a look over the last decade, say, and see what their salary raises have been and how much is going into healthcare.
Right, and the cost of health insurance is coming out of their pay, but I mean, but they can't. They almost have no negotiating capital left to talk pensions, vacations, terms and conditions of employment. So
I think that's a good point. You have to encourage people to look at their total compensation, so wages and benefits.
Yeah. Mark, did you have a comment on that?
I was just going to say that it's easy for a union person to make the assertion that that they've got great coverage, but I think that if one has good information as to what healthcare coverage is costing us per capita in the United States, one should challenge them and find out what the total cost of healthcare is per person in their union, because the chances are that if their coverage is good, their cost is going to be very high, and that's going to be negatively impacting their take-home pay.
A member of IBEW, I think it was, or else it was a mining labor union, back a couple summers ago when we were doing park events, told me that his out-of-pocket premium was $1,400 a month, and that didn't include a deductible for every member of his family. I don't call that a great benefit. So
Yeah, that's not something to hold on to.
fight for that. Yeah.
That's certainly higher than the average per capita cost in the United States.
Let's fight for that.
Yeah.
Dave, did you have a comment to make?
Yeah, as a former union member, I think about this a lot. And if I would have had all of the money that I lost into the employer was throwing into healthcare, instead thrown into my wages, my pension would be, benefits would be higher now. My 401k benefit, or I could have thrown more into there. And of course, I also, when you think about Social Security, it's based on your income.
You're
It's kind of a cascading effect that's going on, that we're throwing tons of our money and we're ending up with stagnant wages, and we don't even know what could have been by the time you get to the end. So
Very good point. Maybe we should have eventually, I'll just throw this out there, an executive summary or a talking point for this whole labor union question, because it comes up a lot. And we could get Rose to help us, you know, after her contract negotiations are done, and maybe when she's retired, and she's going to be a liaison with the national campaign for the labor campaign for single payer, I believe. You know, we could get some good, hard-hitting talking points for that. Good question, though.
You're so funny, Rose will never retire.
But she's gonna go, we hope, go on to something bigger and better with us. Yeah. Allison?
Allison,
Yeah, hi, I'm Allison. I'm a second year medical student and I just finished the PNHP internship program this past summer. And I just wanted to like do a little plug / question for the group with the hive mind. So on November 14th, the Students for a National Health Plan is bringing Senator John Marty to campus to talk about the Minnesota Health Plan. I'm presenting a bunch of slides on like the current system, single payer, talk a little bit about the VA, and it's going to be interprofessional. So we're going to have med students, we're going to have public health students, hopefully like dental students show up, PT, all of the above, nursing, of course, although they're much more with it than the med students. But I'm wondering, we'll definitely have everybody sign the petition through PNHP. We'll put the QR code up. We'll also put up the QR code for the email list to get people on that. But is there anything else that, like, off the top of your heads, you're like, please add that to the presentation while you have a bunch of activated students?
Judy, do you want to talk about your Voices of the Future group, maybe?
Yeah, sure. We have a new committee, Allison, that we're forming through HCAM that is geared towards that, you know, college up to like 35-ish range. We just had a screening last night of a documentary called Takeover. We're looking at doing another screening of something called the documentary called The Janes. And so we're looking at building the base of that. So this would be a good group for younger people in that college and graduate education level to get involved in. And so if they want to sign up for that as well, that would be amazing.
Cool. I can tell them to like Google it, or I can find it and link it or something.
I'll send something to Jen and she can send it to you. Does that work?
That's amazing. Thank you.
And you said, what was the date of that?
November 14th.
Okay.
And we can absolutely invite all of those students to our annual meeting and, you know, keep them updated and activated. I'm really excited. So I'm excited to work with you more and get you the resources you need for that. It should be a fun event.
And maybe I know from last night, the events, the buttons are big. All of the students were like, "Ooh, buttons." So if you want buttons and stuff for that, you know, stick it on your backpack kind of thing. You know,
We love
can probably work
stickers
something
too.
out.
Young people love stickers. They can put them on their laptops.
Oh, we don't have any stickers, sorry, yet. Where is the event, Allison?
It's on the East Bank, so it's in the Health Sciences Education Center on the U of M campus.
Well, I hope that you feel even more comfortable after tonight, like just broaching those tough subjects. And, you know, students bring a whole new perspective. And so maybe the next time we do this, you'll be able to bring back some of their questions to us, some of those more difficult ones for people who haven't, you know, faced life in the same way as some of our other activists. So,
Yeah,
I
and
think this-
maybe
oh, go ahead.
I have a thought and a comment. Maybe Allison, if at your event as well, there seems to be a lot of interest, we could do another version of this workshop for the students afterwards too.
Well, this was fantastic. I'm so glad everybody was able to join us tonight. We hope that everyone, there was a takeaway, something that you can, use in the future as you go out and talk about the Minnesota Health Plan and single payer reform. This event tonight was in a very big week of events, and we have some big ones coming up yet this weekend. So this Saturday on the 15th at 1 p.m. at the Columbia Heights Public Library, there is going to be a caucus event. So the Minnesota Health Plan Caucus, a group of 4 young legislators, they said, we're all in on healthcare for Minnesotans, and they formed a caucus. There are over 60 co-authors of the Senate and House, Minnesota Senate and House bills for the Minnesota Health Plan, and they're going to be answering questions at the Columbia Heights Public Library this weekend, Saturday the 15th at 1 p.m. Oh, Jim, did you have a comment on that?
Well, go ahead. There's a door knock also on Saturday that I might be worth mentioning.
Yes, absolutely. Do you want to talk about that as well? That's in the morning, right?
Yeah, I'm going to turn to Dave Garibaldi. It's out in his neck of the woods.
Yeah, we're going to be getting together at about 9:30 or 10 o'clock in that area, and we're going to be at the Maple Grove Public Library. I don't have the address in front of me, unfortunately, but we're knocking for Farhio Khalif, who is running for the Senate in Senate District 37. That's the Maple Grove area, and a bunch of smaller cities just to the west in Hennepin County. And she is taking on Senator Warren Limmer, who has been a major obstacle in any sort of healthcare reform in the state of Minnesota, including the Minnesota Health Plan. And Farhio is a big proponent of that, and many other things that we need now. And she's just an excellent candidate. So I'd love to see folks, if you want to come out and do some door knocking, we'd love to have you.
Dave, the address is 8001 Main Street, 8001 Main Street in Maple Grove. And probably wouldn't hurt to let either Dave or Judy know if you're coming. The other, I don't know, if you haven't done door knocking this year, there's a special phone app that they like you to have. I don't do it because I don't want to putz with it. So I request paper, which you can do, but we should know ahead of time. Number one, if you're coming, and number two, if you want to try to use the phone app, or whether you'd rather have the old typical paper lists of addresses. Good chance to practice our new skills here.
Yeah,
I will
good
tell
points.
you, I'm kind of a proponent for minivan now. It was tough sell for me too a little bit, but it does save a lot of data entry for the party volunteers. They can do other things that are more productive. It doesn't take very long to load. You know, these young people who are sending you out on the doors can help you load it. You just set up a password, you leave it open, you put in a new list, the script is right there. Eventually you get used to it and you like it. So I'm a believer now. Go ahead, minivan, meaning Voter Activation Network.
Awesome.
On your phone. The only thing you have to remember is have your phone charged up, because it takes a lot of battery, and then have an auxiliary battery if you can with you. Those are my top hints. Election day, November 8th. I'm going to put a big plug in for GOTV. I will be getting out probably almost every day from October 22nd on. We have to get out the vote this year for our progressives, and we have to have re-elect and elect people who care about health and human services and the planet and American democracy. My personal pitch for everyone to get involved. It's not that hard. I actually prefer door knocking to phones, but do it phones, doors, postcards, whatever you can do, this is the time to kick it into gear.
And that's another good conversation starter is you can ask, are you a healthcare voter?
Mhm.
And if they don't know what that means, there's your in. So get out and vote on election day and then come back and see us a couple of days later for an event with Rose Roach. She will be talking about ACOs, HMOs, and all of the EIOs of US healthcare. So all of the acronyms, come and find out what they mean and what they mean for you and your wallet and how we talk about them. So that'll be Thursday, November 10th at 6:30 p.m. And then our December educational event is going to be our Healthcare for All Minnesota quarterly meeting. And we're hoping to have a guest speaker on that date. We will keep you updated with emails on that. So we thank you all so much for coming today. Stay connected, make sure you're checking your email, reading those and finding out everything that's happening in the movement. If you're not on a list for both HCAM and PNHP Minnesota, the next slide, Anne, is the email addresses for those organizations. You can email any of us or go to our websites to make sure that you stay connected. And when we have action alerts, be the first to know and make sure that you are sharing those action alerts with other supporters. Because like we said at the beginning, it's not just one voice, it's making sure every voice says what they need and demanding change. And that's what we're here for. So we really hope that everybody had a good evening and that you learned something. And we hope to see you back again for another educational event soon. So thank you so much.
Thanks, everyone.